from the companies, but really we need a setup where we're, you know, I did orthopedic medicine in a previous life, and we had a situation where when we were doing disc removal, some patients still had pain. Now you get disc degeneration and you get collagen breakdown, and it's the same thing as this. Now we found that the pain was directly related not to what you've seen on the x-ray, but to pre-inflammatory cytokines, PICs. And so some of the patients that you were treating didn't have that problem at all. So in California, they did a study with 100 MRIs on normal people and discovered that 2 to 3% had all discs out that were totally asymptomatic, weren't causing a problem at all. So we were treating these patients, doing surgery on them, and they still had the pain. Whereas the collagen breakdown, if you're measuring it, gave a direct relationship to the pain, which is interesting. And this is probably what's happening here as well. I think in 3 months, the hyaluronic acid has been broken down into smaller molecules, and they're inflammatory. So in terms of why it's happening, if we look at 2 different things, infection on one side, and I'm not saying it's not, but you know, PCR show uncommon bacteria, and to me as a scientist also, why are we getting weird bacteria? Because, I mean, this is coming from the skin or within. Then we know that low molecular weight hyaluronic acid in this presence of local bacteria do become inflammatory. That's well established in medicine. We know there's a neutrophilic response because you form pus, even though you can grow nothing on it. And we know that the skin barrier is altered because you're breaking the skin. Then why is it happening in 3 months? So in terms of inflammation, they respond to steroids, we know that. They respond to methotrexate, we know that. They probably respond to dapsone. I'm getting ahead of myself here because I haven't done any dapsone patients. There's poor or no response to antibiotics. Nothing grows in culture and sensitivity. Why is it always uncommon bacteria? And then in terms of hyaluronic acid, once it gets below 120 kilodaltons, particularly at 40 and 80, it is inflammatory. So what I think is happening is, why it's happening 3 months later is that when the body is breaking down the hyaluronic acid, large weight molecules to smaller ones, they set up an inflammatory reaction. Now there's a direct relationship as well, secondary to the production process of the different companies using, and it's not even the BDDE linking compounds, but it's the way that they're broken down, and nobody really has looked at that. But I think that's what's happening, you know. So in terms of different, I suppose, papers that are out there for publication, that one there shows that definitely low molecular weight hyaluronic acid exhibits pro-inflammatory effects. And I think that's what we should be looking at. Tissue injury does the same thing. So I think we're just looking at the wrong thing. And we've been putting up with this problem now for 20 years, and we really need to put our heads together because you had some cases today you were telling me. I've had 2 cases today sent to me, and so it's not going away. So, vascular occlusions, okay. So, where are we with vascular occlusions? Again, I have my own ideas about this and how we should treat them. The first case we've seen here was by a colleague of ours, Lucy Clancy at RSM. That's come back to 2008, and Lucy presented a case that she'd blinded a patient by using Sculptra superficially, and I had also then other cases sent to me. So that's now